For the past 3 years, CBS 6 has been investigating accusations against certain staff members at the Cumberland Children's Hospital in New Kent County. Well, dozens of former patients have filed lawsuits.
Now we've learned that more accusers have come forward. Our Laura French has an update to this Problem Solvers investigation and a warning. Some of the descriptions of the alleged abuse that you're about to hear are graphic.
The current lawsuit is unfortunately more of the same thing.
9 former Cumberland Hospital patients suing the New Kent Children's Hospital, its owner, and former medical director Daniel Davidow for more than $147 million for physical and sexual abuse.
And we have a young boy who was at the facility, a teenager, who was strangled and choked out by a behavioral technician. We have others who have suffered other forms of abuse or maltreatment while they're at the facility, things that unfortunately we've seen repeatedly.
Like these 8 female plaintiffs, all accusing Davidow of inappropriately touching them while in his care inside the facility he was forced out of in February 2020 after a CBS 6 investigation into abuse and neglect claims against hospital staff.
That individual, according to all of these young women, is placing his ungloved hand underneath their clothing and touching them in their intimate body parts underneath their waist. And so we have now more than 24, more than 36 consistent accusations of the same conduct from young women that have been there not just in a 1 or 2 year period of time in which they could have come together and decided what to say about this man, but over a decade. Over a decade of young women who say the same thing has happened to them.
According to the new complaint, Davidow fraudulently stated that he needed to check the minor patient's femoral pulse to coerce the minor patient's compliance with his demands. The suit details graphic sexual assault allegations dating back to 2009. CBS 6 sat down with Dr. Melissa Nelson of Pediatric Associates of Richmond, who is not affiliated with this case.
In pediatrics, it's important to assess a baby's femoral pulse as a critical way to pick up on congenital heart disease, especially in the newborn period. I think the last time I would check a femoral pulse is probably around 6 months of age.
All 8 of Davidow's accusers claim they were first abused upon admissions, and 3 of them say it involved an invasive exam.
Would it ever be appropriate to do a femoral pulse internally in the vaginal area?
I can't think of any indication to be doing an internal femoral artery exam. I don't know how you would even do it.
And one complainant alleges that Davidow was not wearing gloves at the time.
Would it ever be appropriate to do a vaginal exam without gloves on?
I would never do a vaginal exam without gloves on. I've been a pediatrician for 20 years, and I have never seen an indication for doing a femoral pulse exam on an adolescent. So when I hear about an adolescent who's having femoral pulses done by someone without gloves on and doing it regularly and also feeling their pubic hair during that assessment, I've got a lot of flags going up, and they're not good ones.
Since October 2020, 47 former patients have filed suit against Cumberland Hospital, seeking more than $388 million. Of those, 38 are accusing Davidow of sexual misconduct.
This was supposed to be a place where you got better. This was supposed to be a place where they sent you to get care, to get treatment, to improve your life. But really what it was a prison. We, within the legal system, need to be able to demonstrate to these young women that we're going to uncover the truth.
Dr. Davidow has not been criminally charged. He and the other defendants in this case declined to comment on the complaint due to pending litigation. The Virginia State Police and the New Kent Commonwealth Attorney's Office both tell CBS 6 their investigations are still ongoing. Working for you, Laura French, CBS 6 News.